Hi everyone, it's Philip here from Vet Education. Thank you so much for joining us. What is just going to be a short wrap up of some of the research papers being conducted on the use of biomarkers for the identification of sepsis in an attempt to predict survivors from non-survivors in critical illness. There's a lot of work being done in this area, and we just thought we'd bring together some of the recent and a couple of not so recent papers. Search for the ability to predict the likely outcome of a critically ill patient long before the actual outcome has been going on for a number of years. And actually having this ability has an important ramifications not only for our patients who must endure their illness and treatment interventions, but also for the client who has to pay sometimes quite significant amounts of money to pay for treatment of their critically ill pet, and also for veterinary hospitals who invest a lot of resources in the care of these patients as well. So several studies actually have been conducted in dogs and cats to determine the diagnostic and prognostic utility of serum biomarkers in patients with severe illness. And as yet, however, there are no confirmed reliable biomarkers able to detect survivors from non-survivors at the time of diagnosis, but trends in several biomarkers may help distinguish survivors from non-survivors over time. So we're going to have a look at a couple of studies that look at that. So as we know, sepsis and SIRS, or systemic inflammatory response syndrome, are associated with an increased production of inflammatory cytokines, things like tumor necrosis factor, interleukin-6, and so on. And in addition, sepsis is associated with decreased production of the anti-inflammatory cytokine interleukin-10. So let's have a look at some of this literature surrounding these biomarkers and see what's been found. The first article we'll review is an original study by Gomerin and colleagues published in the Journal of Veterinary Emergency and Critical Care in January of 2018, looking at inflammatory cytokine and C-reactive protein concentrations in dogs with systemic inflammatory response syndrome. Well, in a study, 69 dogs with a diagnosis of systemic inflammatory response syndrome were included in the study, and the dogs were diagnosed with SIRS using the classic SIRS criteria, which includes an elevated or depressed body temperature, an elevated or depressed white blood cell count, an elevated heart rate, and a slow respiratory rate, with a dog meeting any two of these criteria being eligible for inclusion in subsequent analysis in the study. In this study, blood was taken at presentation, then at 6, 12, 24, and 72 hours post-presentation, and at least 1 month after discharge for those patients in which that was possible. The sort of diseases these patients had included GDV, infection, neoplasia, trauma, kidney disease, gastroenteritis, and a range of other conditions as well. The blood collected was tested for C-reactive protein, interleukin-6, and tumor necrosis factor alpha, three pretty common markers there in sepsis and systemic inflammatory response syndrome. In the study itself, 8 of the tested dogs died, 17 were euthanized, and 44 dogs survived. What they found in this study, having looked at all of the data with survivors versus non-survivors, is that C-reactive protein concentration was found to be increased in dogs with clinical signs of systemic inflammatory response syndrome and was positively correlated with increasing plasma concentrations of interleukin-6 as well, so they were both elevated. However, neither absolute values nor changes in blood concentrations of C-reactive protein, interleukin-6, or tumor necrosis factor alpha helped to identify either the underlying cause or to predict outcome in that particular cohort of dogs. And there are a couple of biases in there. Obviously, a number of patients were euthanized and the sample size was reasonably small, but those findings nevertheless are quite interesting. The second article we'll look at is by Casey Cohen and colleagues that was published in the same issue of the Journal of Veterinary Emergency and Critical Care as the last article in January of 2018. And this article presents a retrospective evaluation of the prognostic utility of plasma lactate concentration in combination or in isolation with base deficit, pH, and anion gap in canine and feline emergency patients. The authors, being a retrospective study, they reviewed the records of 566 dogs and 185 cats presenting to the emergency room at the referral institution that it had venous blood gases and blood lactate performed within the first 2 hours of presentation, because they wanted obviously to capture that period of time when these patients first arrived. The patients were admitted for a whole range of reasons, including trauma, hemorrhage, sepsis, neoplasia, respiratory disease, cardiac disease, liver disease, gastrointestinal disease, including gastric dilatation, volvulus, and pancreatitis, urinary tract disease, endocrine or reproductive disease, neurological, hematological disease, and also toxicoses as well. Now, interestingly, cats with lactic acidosis had the highest mortality rate amongst the feline population. That was 49%. So if you're a cat with hyperlactatemia and acidosis, meaning you have lactic acidosis, your mortality rate was 49%, versus a cat with hyperlactatemia and no acidosis, your mortality rate was 44.6%, or if you had a normal lactate, your mortality rate was 22.6%. In dogs, we had a similar kind of story. Dogs with lactic acidosis had a mortality rate of 59.8%, whereas mortality rate in dogs with just hyperlactatemia and normal blood gas analysis, along with those with normal lactate and normal blood gas analysis, was around 24%. There was no statistical difference in those patients hyperlactatemic with normal blood gas analysis and those without hyperlactatemia. They're both sort of between 21 or 22% and 26% in that particular study. So what we have in both dogs and cats is that if you have lactic acidosis, so you have an acidosis as well as hyperlactatemia, your mortality rate is higher in both cats and dogs. So the results of this study say that really indicate that median plasma lactate concentration and anion gap were higher, and base deficit was more negative and pH was lower in non-survivors than survivors. So I'm just going to repeat that in median plasma lactate concentration and your anion gap were higher, and the base deficit was more negative and the pH was lower in non-survivors than survivors. That really just tells us that patients with acidosis and hyperlactatemia were more likely to die. Blood pH, plasma lactate, and base deficit all were independent predictors of mortality in dogs. So if those levels were abnormal, then they were independent predictors of mortality in dogs. But only plasma lactate was an independent predictor of mortality in cats. So the study concludes actually that in addition to the above-mentioned findings, that the presence and magnitude of hyperlactatemia on presentation in the ER may help to identify both dogs and cats with a high likelihood of in-hospital mortality, particularly if they're present with acidosis as well. And this means that evaluation of blood gas along with blood lactate may have more value than just testing blood lactate alone. The study did not look at subsequent lactate readings over time to determine if the rate of decline in lactate offered greater sensitivity, and this is really an important area of further research that's recommended. There are a few other studies that I'll mention briefly. In another study of 45 dogs with sepsis or non-infectious systemic inflammation, concentrations of tumor necrosis factor, interleukin-6, interleukin-10, and CXCL8, that's CX chemokine ligand 10, were measured and analysed against survival and the ability to differentiate non-infectious SIRS from sepsis. Interestingly, none of the biomarkers had optimal sensitivity or specificity for the diagnosis of sepsis, and none were predictive of outcome. In another study of 61 dogs with sepsis and non-infectious SIRS, both C-reactive protein was measured, and there was no significant relationship between survival rate in dogs with non-septic SIRS or sepsis and the initial serum C-reactive protein concentrations. However, over the 3-day study period, surviving dogs displayed a significantly greater decrease in C-reactive protein than non-survivors, and it's this reduction that correctly predicted survival in 94% of dogs and death in 30% of the dogs, with a false positive rate of 22%. So that's really interesting. We track C-reactive protein over time. We see that the change in concentration offers a greater sensitivity in terms of predicting survivors versus non-survivors. In another study of 20 dogs with sepsis compared to 28 control non-septic dogs, protein C, antithrombin and prothrombin time, partial thromboplastin time and fibrinogen degradation products and D-dimers were measured within 24 hours of admission to hospital. Protein C and antithrombin activities were significantly lower in dogs with sepsis compared to controls, and additionally, dogs with sepsis had a significantly higher PT, APTT, D-dimer, and FDP compared to controls, so they're more likely to have the sorts of things you'd expect to see with DIC or disseminated intravascular coagulopathy. Platelet counts were not significantly different between the control and the subject group, and 10 of 20 of the septic dogs, as 50% of them died, but no association was identified between any of the measured values and outcome. So a subsequent study showed that protein C and antithrombin activities changed significantly over time with sepsis, and increasing concentrations of both protein C and antithrombin over the course of hospitalization for sepsis is likely related to survival. So all of these studies contribute to and build on our understanding, I guess, of the predictive value of cytokines and metabolites in patients with severe illness. Currently, however, blood lactate in combination with blood gas analysis, as well as trends in concentrations of protein C and antithrombin, may provide some insight into survivors versus non-survivors. And more research is currently underway, and it's a pretty interesting field that will hopefully help us as clinicians in the field best direct our treatment and resuscitation efforts while assisting decision-making processes for our clients and their beloved pets as well. So hopefully that's just provided a little bit of a glimpse into some, certainly not an exhaustive literature review there, but it's just given you a little bit of an insight into some of the work that's going on and how difficult it can be to sort of pinpoint a particular marker that is reliable all of the time for these patients. And we're not really quite there yet in terms of finding these markers, but there is a lot of really exciting and interesting research currently taking place, and we'll wait for that to be published and see what the results of that will be. Thank you so much for taking the time to listen to what we've spoken about today. If you're interested in finding out more about sepsis, systemic inflammatory response syndrome, Vet Education has an online course that's starting at the end of April 2019. Jump onto our website, veteducation.com.au, click on the Vet Courses tab and check out the week-by-week breakdown of that course. If you have any questions at all, please feel free to email us here at Vet Education. It's info@veteducation.com.au. Thank you so much, everyone. I hope you have a fantastic day.